Listen up, college kids. I know we're all out having fun and partying and just trying to get through finals, but there's something that we need to talk about, and it really needs discussing. It's called gonorrhea, and here's what you need to know. I'm sure you've heard of it as the clap or the drip, but gonorrhea is actually caused by a bacteria that manifests in mucous membranes and is transmitted by having sexual intercourse or contact with someone that's also infected. Gonorrhea is caused by the bacteria shown here. The symptoms of gonorrhea can be really nasty, but it may take up to 10 to 30 days for the symptoms to even show. So you may be infected and not even know it, or someone may infect you and they don't even know they have it. Side note, my sister had gonorrhea a couple of years ago, and let's just say you don't want to have it. In men, gonorrhea symptoms include greenish, yellow, or whitish discharge from the penis, burning when urinating, burning in the throat due to oral sex, painful or swollen testicles, or swollen glands in the throat also due to oral sex. This is according to WebMD. Also, according to WebMD, gonorrhea symptoms in women include greenish yellow or whitish discharge from the vagina, lower abdominal or pelvic pain, burning with urinating, conjunctivitis, bleeding between periods, spotting after intercourse, swelling of the vulva, burning of the throat due to oral sex, and swollen glands in the throat due to oral sex. If you're concerned or have any of the symptoms, go to your doctor right away to be tested. They'll take a swab of your penis or cervix, depending on which one you have, and we'll be able to tell you if you test positive or negative. Good news though, if your doctor does take a swab and finds out that you test positive for gonorrhea, there is a cure, and your doctor will put you on antibiotics because it's caused by bacteria, and your gonorrhea should be cleared up by the time you finish your medicine. The best way to prevent any sexually transmitted infection is to talk to your sexual partners before intercourse to make sure there's no cause for concern. Also, always wear a condom when rolling in the hay. Condoms prevent the spread of sexually transmitted infections to begin with, so you won't have to worry. Gonorrhea is most common in people with multiple sexual partners. While condoms do a great job of preventing the spread of STIs, choosing wisely in sexual partners and keeping them to a minimum is often a great idea as well. Just a few statistics you might want to know. Teenage girls are the highest percentage that are affected with gonorrhea. Gonorrhea also causes pelvic inflammatory disease, and that affects over 1 million women each year. Just a little embarrassing information about the wonderful state we live in. Louisiana actually rated #1 in the nation for number of gonorrhea cases, and it's runner-up on several other sexually transmitted problems. This is very important to know because this is where we live, and these are the people that we see all the time. Knowing what sexually transmitted infections are out there, what they look like, and how you can avoid them is one of the best ways that you can protect yourself against having to deal with one in the first place. In conclusion, gonorrhea is a nasty infection that can be 100% preventable. So always wear a condom, talk to your sexual partners, and get tested regularly if you're sexually active.